Good morning, everybody. Welcome to our regularly scheduled Virginia Caregiver Coalition meeting. I will be stepping in for Chris Newford today. Maybe he'll be able to join us a little later. I'm going to have Donna help keep me on track here in case I get rambling. I didn't expect to have to run the meeting, so I don't really have any prepared remarks or updates. I'd like to welcome all the new members who are able to attend. Especially, Jeremy, and I don't know if we have any other new ones. Zipporah, you're a recent member, but you were at the last meeting, if I remember correctly. So welcome to everybody. I just have a few updates from the last meeting. Some of you know that we've still been working on the Virginia Caregiver Guide. We are about done with it. So we'll be getting ready to finalize that, and then we're going to translate it into Spanish, and we're also going to do a large print version and get it ready to either distribute online, and then we're going to print some off so people can have paper copies as well. I have been on a Arch Respite Lifespan Learning Symposium, and I actually bragged about it yesterday afternoon. So I was able to brag to some other states about what we've been doing here in Virginia, which has been really nice. We also, in the last meeting, we had talked about we had applied for another lifespan respite grant that would extend the lifespan respite voucher program 5 years, and it would be a really large increase in our funding. And we did receive that grant. So the lifespan respite voucher program will be extended for another 5 years. We will be able to increase the voucher amount from $400 to $595. We are also planning on putting in place some mechanisms where the program normally worked, where the caregiver would have to pay upfront for the cost of respite, and then we'd reimburse them. But if they are using an organization like a home care organization or a nursing home or something like that, we're going to try to get procedures in place where we'd actually be able to pay that organization directly, so it wouldn't eat so much upfront costs, to try to reduce the issue, especially with fixed incomes and stuff like that. We're also going to allow multiple smaller reimbursements if people need that. Before it was you could only request the amount after you were all done, but now we've had people say, I only have Social Security, so I don't, so we're going to say, okay, well, you can take it in a couple increments spread out over time to make that financial burden a little bit less. We're also hoping to do some kind of general education videos. Yesterday we saw in Colorado, they had created videos on like tips for avoiding pressure sores and how to, tips for transferring your loved ones, kind of ways to help caregivers get better at the skills they may need, during their caregiving journey. And we were really interested in doing something like that. We have to be careful because it's not, training, it can't be stuff like that, but I think general education was a really interesting concept. So I do plan on following up with Colorado. Alabama also had something interesting where they were giving stipends so people could have 3 sessions with a counselor. Caregivers who are experiencing stress and burnout would get 3 free sessions with
mental health
certified counselor, which I was thinking of that, and I don't know, if counselors are still can't, people are having trouble finding counselors, so I don't know how, okay, you have a stipend, but if you still can't find any counselors, how are you gonna do that? I don't know. So that would be interesting to follow up with her as well on that.
That's an interesting. Can I ask a question about that? About the respite with the new grant? Is there a priority audience? I know, like at one time we were prioritizing grandparents raising grandchildren or something like that.
Yeah. So before the grant that we're wrapping up now, was caregivers caring for an individual with a diagnosis of dementia, other relative caregivers caring for an individual 59 or 19 to 59 with some sort of severe disability, and then grandparent caregivers of a child with a disability. This time around, we're going to increase our focus on rural caregivers, LGBT caregivers, Native American caregivers, and we're still doing dementia. Kathy, you're muted if you're talking to me.
And male caregivers.
Oh, and male caregivers. So you change it a little bit. The ACL was looking for some different target populations, so we kind of adjusted accordingly based on what we had been looking at from the data we gathered through our own lifespan program.
And Nick, did you say that Virginia was one of only 6?
Oh yeah, and there was only 6 grants issued. So we were one of 6, which is pretty impressive.
Oh.
And I would shout out to Emily Hoyt, who worked her butt off to make the grant possible. Without her, I don't think we would have gotten it. Dee's question.
And Emily, just so you know, is now the senior advocate for Henrico County. She just started there this week. So we'll have to make sure she gets this invitation, because she will probably want to certainly be a member of the coalition.
That's a good.
Hi, Nick. Could you repeat those groups? I've got 3 of them: rural, LGBT, and male. Could you repeat the other ones?
Rural, LGBT, male, dementia still, and Native American.
Thank you.
Mm-hmm. Oh gosh, there was something else I was going to say.
Dee's question.
Dee's question. No, we are actually we're changing the requirement to you only have to not reside, but you have to be the caregiver most of the time, and you do not have to reside at the same address full time anymore. Because we wanted to change that, because like when I was caregiving, the caregiver for my grandfather, I didn't live full time with him.
Right.
He lived a mile down the road, but I was there every day, for multiple hours. And I wanted to try to account for those, individuals, especially if, you're caring for your parents, but you have your own, husband and children, and you live nearby. You can't just kind of move in, so we're trying to keep that in mind as well. And we're also trying to do some marketing and, trying to get the word out there. We're also Liza and I are going to be working on creating a program manual for the grant. So either if area agencies on aging are interested in trying to replicate the voucher program on a smaller scale, or if other states are looking to see how Virginia is doing things, we want to have a resource for them as well.
I would appreciate that, Nick, just so that I get my information right when I do share the information, because I do share it a lot.
Yeah.
Because it really is the only resource I have to give people other than ours in-house. So you guys can end the meeting right now. That's a bunch of news.
Well, there's actually there's some more news that Dee, you may have heard about yet or not. But with the Older Americans Act, with the new reporting that we will be doing to the Administration for Community Living starting October 1st, ACL is allowing AAAs to do a respite voucher program themselves using National Family Caregiver Support Program, or Title III funding. So it is being added to the area plan as an option and to the AMRs. So that has opened up for all the AAAs. And so Nick's manual is going to be necessary actually to help the AAAs that want to do a voucher program, so that they, that they have some guidelines.
At all times, right?
Mm-hmm. Perfect.
Also, I don't know, for like the area agencies and aging, those people in attendance today, about the RFP, Kathy.
of the Lifespan Respite Care Initiative,
Yeah.
RFP. There's been some miscommunication somehow with our contracting group. It's been RFP twice and we've only gotten 3 proposals, and we currently have 11 participants in that program. So we're going to have to end that RFP and try it one more time. And we're going to send out the notices rather than relying on our fiscal staff to send something out to the current grantees to make sure that everyone is aware and has an opportunity to submit a proposal for that. That's the program that provides up to 40 hours a month of respite for caregivers of people with dementia or people who are 80 or older.
I have a question. So I'm from California. Do they have IHSS here in Virginia? I just moved here a couple months ago.
Do they have what?
They have IHSS here, like in-home care supportive services.
Well, I mean, yes.
What is the program called here in Virginia?
Well, I mean, it's not, Medicaid has personal care for people who are eligible and who qualify.
Yes.
Of course, there are a lot of private in-home providers, and some of the area agencies on aging also offer in-home homemaker and personal care services for people who are 60 or older.
Okay.
I don't know, that may be different from what you have in California.
Yeah, I just I don't know if it has a different name here. Because over there is in-home health supportive services, IHSS, and the maximum hours you can get over there is 283 hours. And that's if you need around the clock 24-hour care, which the state does not provide to you. But if you're in that situation where you need 24-hour care, the maximum would be 283 hours.
Yeah, the program, the personal care program, it's under managed long-term services and supports, and it's a waiver that's offered through Medicaid. It's managed by the 6 managed care providers or the MCOs that contract with Medicaid in Virginia. And so the care plan is set up. They don't provide 24-hour care, but you can get for people who require supervision. It used to be, and don't quote me on this because since the MCOs got involved, I'm not sure what they're doing. But what it used to be is that you could get like 9 hours of care a day so that the caregiver could go to work at least. And then there's something like, maybe somebody on the call knows, around 420, I think, respite hours that can be provided under Medicaid for the caregiver, in addition to the regular weekly care plan hours.
So out of my office, what do we call Office for Disability, we have personal assistance services programs too that provides personal care. It's consumer directed stuff, and I don't know if that's what you're talking about, and I don't know what the rules are because that's not what I do. But I mean, if something like that's of interest, I can always forward information on it.
Mary said 480 hours per fiscal year of consumer direct.
480. Okay.
That's not a lot.
Okay.
It used to be around 600 at one point in time, and they reduced it a number of years ago.
Wouldn't that be nice?
Joe, I saw that Joe joined the call. Joe, do you remember how many respite hours Medicaid used to provide for personal care before they cut it to 480?
I think Joe dropped out actually.
No, I see her.
Oh, there she is. Oh,
She's
sorry.
there.
Oh, there you go.
Okay, I'm unmuted finally. I thought it was 720,
I
but
think you might be right. It was a lot, and then they cut it pretty drastically.
you put it way back. Okay, yeah, that's the figure that comes into my mind. But it's been a while for me. I've been.
I think you're right. I think 720 sounds right now. Yeah.
Okay.
I
I'm
think I was gonna say I took care of my father like for 2 years. I was still active duty military. I had just gotten married. Me and my husband were separated for 2 years because my father got sick around my wedding day. So I had to run back to him. I was with him. I ended up staying with him for a year, helping my mother. And then when I was planning to come here to Virginia to meet with my husband, COVID hit. So then I got stuck in California another year. So I've been married like 2 years and some months, but we just moved in 3 months ago. Can you believe that? Yeah.
Really getting your honeymoon.
Yeah. So it's been a long journey. But yeah. When I was in California, I had to fight, for the hours, because initially they were just giving me like 23 hours, which it was like crap. Sorry, but I fought like for like 4 months, I would even cry on the phone. I was so like devastated, and I was able to get him 3,396 hours a year.
Wow.
Wow.
Yeah, but I fought for
Never
it.
get that in Virginia.
Yeah.
Medicare doesn't offer respite care, do they?
No,
I didn't think so.
no, they don't do any chronic care. It has to be any in-home services that Medicare provides have to be related to a skilled care need.
Oh, that's right. And even that's
Yeah, and
Unfortunately.
now the way the way the home care providers get paid, they try to get in, do training of the family and get out.
okay. I guess I can open it up to anyone who has any updates from around the state. If there's any education programs going on or anything of interest that anyone wants to share. Anyone? No? Okay. Donna, do you have an update from the education committee?
No, just except to say that I'm going to be convening a meeting of the planning committee in the next couple of weeks. And I know a couple of people are on here that are on that committee. So just get ready for my doodle poll, looking for times, and then I will set something up.
Okay, cool. Okay, well, do we want to move into our presentation since we have Moretta here?
Yay.
Donna, would you like to do introduction?
Sure. Well, Moretta just went off video. Are you ready? There she is. She's on. Are you on mute?
I was.
Okay. So today we're going to be talking about cultural brokers. Moretta Copeland is a cultural broker to the African American community with a partnership for people with disabilities. And she's going to be talking about some of their work. Her presentation is called The Use of Cultural Brokers in Supporting Families and Caregivers of People with Disabilities. So Moretta, on to you.
Well, I'm going to get my, so Nick, I apologize, everyone. I guess I need to have my slides up. Right.
No worries.
All right, hold on a second.
Have you made her a co-host?
Yes, I did.
All right, bear with me one moment. I do apologize.
Also, Moretta is our membership chair and has been involved in the VCC for a number of years now. She's on the executive committee with us.
Oh boy. Hold one moment.
Also, I can pull them up on my end too, Moretta, if you'd like.
Yeah, could you do that for me, Nick? I would appreciate it.
Yeah, I got you.
Thank you.
Screen share. Okie dokie. Myself. All right, ready?
All right, I'm ready.
And just tell me when you want to advance the next slide.
Okay, next slide, please. Next slide. Okay, next slide. Okay, so I'm going to talk a little bit about, I work for VCU Partnership for People with Disabilities, and we are under the School of Education at VCU. The partnership has been around since 1985. So a long time. The Partnership for People with Disabilities is Virginia's UCED, spelled UCEDD. UCED stands for University Center for Excellence in Developmental Disabilities. All states have a UCED. There are some states who have two. There are a total of 67 nationwide. Next slide, please. This just lists some of the key initiatives that the partnership has. I'm actually only going to focus on the Center for Family Involvement, which, as you can see at the bottom left. Next slide. Next slide, please. Thank you. And before we move any further, I want to go ahead and give a description of myself. Obviously, I'm an African-American, a Black woman. I'm wearing a dark blue shirt. I have silver earrings in my ear. I have curly hair. Anyway, I just wanted to do that because there are some people who may just be listening, or people who may have visual impairments. So a little bit about the Center for Family Involvement. The Center for Family Involvement was established back in 2005. We currently have about 23 staff. All of us are either family members or people with disabilities ourselves. And we are totally grant funded, as well as the Partnership for People with Disabilities, 100% grant funded. And that, as you can see here, some of our funders that are listed below, and DARS happens to be one of them. The United States Administration on Intellectual Developmental Disabilities, the Virginia Department of Health, and others. Next slide, please. Okay, so the Center for Family Involvement, I'm just going to focus, under the Center for Family Involvement, there are two types of support that's provided, direct support as well as indirect support to families. So one of those supports is one-to-one, and that's our peer support, which I'll talk about a little bit later, information and referral. And then indirect support to families that involves trainings that we do throughout the year. Next slide, please. Okay, so this is just, these are some of the projects that are under the Center for Family Involvement umbrella. The Family to Family Network of Virginia, which is what I will be talking about today. That's where our cultural brokering program is a part of that. Yeah, so these are some of the, like I said, some of the projects that are under the Center for Family Involvement umbrella. Next slide. Next, thank you, Nick. Okay, so the Family to Family Network is modeled after our sister organization, a national organization, the Parent to Parent USA. And they're very intentional about matching parents, seasoned parents, experienced parents with parents who have children who have been newly diagnosed with some kind of disability or special healthcare need. Next slide. So as you can see, this is the Family to Family Network's mission statement: increasing family skills so that they can be advocates and leaders in their communities, and so that them as well as their loved ones can lead the lives that they want. Our cultural brokering program started in, well, it started in 2009, but we didn't really start working it until 2010. I remember getting hired in 2009, but really, it started in 2009, so I'll leave it at that. So we started off with 2 cultural brokers, and then in 2019, we went up to 5 cultural brokers. So that's really good. As we know that Virginia, as well as the rest of the country, is changing. It's becoming more and more diverse. And so we started out with myself, cultural broker to the African American community, as well as one cultural broker for the Latino community. Today, we have a total of 5, as I mentioned just a few moments before. Cultural brokers work across the state, and we provide one-to-one support to families, or we will also provide support to our colleagues, which I will talk about shortly. Next slide. Okay, so of course, this is a map of Virginia, and as you can see, there the 6 regions. We have what we call regional network coordinators in all 6 regions. As you can see in Region 3, Lisa Richard, she's in the far southwest of Virginia. Rebecca is up in the Blue Ridge Mountains. Jennifer Reese, she is in our northern, she's the regional network coordinator for the Northern Virginia area. We also have Joan Bruner coming on back down. She's in the Tidewater area. And then we have Donald Rebel, who is in the Hampton Roads area. And then in Central Virginia, we have Renee Soniet. It might be a little bit difficult for you all to see, but we have also, in addition to cultural brokers, we have different liaisons, and we also have family educators. Our family educators, they are, if you see the little red, it says red stars, but the little red hearts, they are spread out across the state of Virginia, and they work with families whose children have been recently diagnosed with a hearing impairment. And I know it's difficult to see the little white stars showing cultural brokers across the state. Like I said, there are a total of 5 of us. We also have a couple of liaisons. We have one who works with the mental health community, one who works with aging families. We also have a liaison who works with people who are blind or deaf. And I believe that's it. We have okay, so yeah, that's it. Next slide, thank you. Okay, so we work on 3 different levels of family involvement and engagement, as you can see here. Next slide. Okay, so I mentioned our 6 regional network coordinators. Our 6 regional network coordinators have what we call family navigators. Family navigators are trained volunteers. They're either parents, family members, or even people with disabilities themselves. And they are trained, they have experience. We train them actually through the Center for Family Involvement. A lot of them have already received training in the community, maybe through the Virginia Board for People with Disabilities Partners in Policymaking Program, or PTSI, which is another sister organization, which is the Parent Educational and Advocacy and Training Center. So a lot of them already have, training under their belt, and then we train them, we give them a lot of trainings through the Center for Family Involvement. Again, like I mentioned previously, this is based on the Parent to Parent USA's model. Next slide, please. So these are some of the supports that family navigators provide to families. And I will tell you, we work with a lot of families every year, hundreds of families, and we cannot do the work that we do without our family navigators. They provide information in an unbiased way, information and referral, like I mentioned previously, one-to-one support. They may support families in planning for service meetings, or helping families with their IEPs, their child's IEPs, individualized education plans. Next slide. And you could actually skip this one, Nick. Okay. All right. So I just want to kind of give you an idea of how the process works with the regional network coordinators and our family navigators, and even us So typically what happens is that someone would call in to our helpline or maybe through email, and it would go to, if they call into the helpline, it's going to go to our central office, Renee Soniette. But sometimes they'll call other, they will contact, families may contact regional network coordinators who they've heard about in their area. So that regional network coordinator will do like a little basic intake, for lack of a better word, and they will, get that information from families. If the situation is really, is really complex, then of course our regional network coordinators, they're going to go ahead and work with the families themselves, because like I said, our family navigators, they are volunteers. They're not paid to do the work that they do, and we have to be respectful of that. So if it's not a complex situation, then our regional network coordinators will pass that family's information to one of our family navigators. And then that family navigator is contacted, it contacts the family within 48 hours. And then after, the family navigator has worked with that particular family, they do take a survey and provide feedback, just so that we could always do better and just see, if they were satisfied with the services that they received. That information, the family's information, with their permission, is put into a database that we use called Salesforce. Okay. Next slide. These are just a couple of pictures of my daughter. She's in her happy place on the plane. She always goes to sleep with her, whenever she's on a flight, she will put on her headphones and go to sleep, which is kind of good, I guess. And then this is her over here. I think she's at night to shine or something like that, but that's a picture of my daughter. Next slide. A couple of other pictures of her. Next slide. So moving on to cultural brokers. And if anyone has questions, feel free to, at the end, I will definitely answer any questions that anyone, may have. Okay, so cultural brokers. So cultural brokers are specific to immigrant, refugee, and other diverse populations. So with the Center for Family Involvement, the Family Network, we have 5, like I said. So we have one that works with the Korean community, or Asian community rather. And she's also our diversity specialist. We have 2 cultural brokers that work with the Latinx community or Latino community. We have 1 cultural broker, a male, who works with our refugee and Arabic speaking communities, and then myself. Next slide. Okay, so this is the definition of a cultural broker. A cultural broker, and this definition is from Giuseppe and Saltnick from 2005. Prior to today, had any of you heard of cultural brokers? Had any of you ever heard of that term? No. Some of you.
I just recently started hearing about it with doing the diversity, equity, and inclusion work, and so I was really interested in this. And of course, I heard from you earlier that this was going to be the topic. So yeah, that's all I've heard of it. So thank you for doing this presentation.
I'm glad to do it. So yeah, culture brokers have been around for many, many, many years. So you have cultural brokers who are on the international level where they're negotiating treaties. But I know here in the States, cultural brokers were initially used in hospital settings, healthcare settings rather, and to work with those communities who may be hesitant to get medical treatment and so forth. And so that's where cultural brokers really became more prominent. And so so this is a definition. Cultural broker acts as a go-between one who advocates on behalf of an individual or group. Next slide, please. So the role of cultural brokers. The primary role, in addition to parent-to-parent support, is providing outreach to organizations. That's, you know, some of the work that we do. We also support like the partnership as a whole. And I would say that not only cultural brokers, but our regional network coordinators and our 136 educators, as well as all of our liaisons. I would say the biggest thing that we do is providing emotional support. It goes a long way, you know, with families and caregivers, having someone to kind of, you know, be there to listen and understand some of the things that they're going through, because, hey, we've been through it or been through something similar. So it makes the world of difference. And with cultural brokers, having someone that you can identify with, you know, from your culture can be really, really helpful in, you know, helping to establish trust. And maybe, you know, I've worked with quite a few families where, you know, there have been like miscommunications, misunderstandings, assumptions being made, and being able to partner with the families, and also service providers. We do a lot of work with service providers, you know, trainings and so forth, and, you know, helping them better engage families from diverse backgrounds. And that is why our cultural brokering program was established. It was because, of course, you know, Virginia's becoming more and more diverse. But yeah. Yeah, so that's why, like I said, our cultural brokering program was established to meet the needs of those families who, you know, I mean, there was research being done, and it was shown that there were populations of, you know, families and caregivers where they just weren't being reached. They weren't getting services. They weren't they weren't navigating the different disability systems. So I'm very thankful that the Cultural Broker Initiative was established. I wish it was around when my daughter was younger, because I could have really benefited from this. I remember going to our daughter's very first IEP meeting in school, and it was my husband and myself, and there were about 14 professionals at this meeting, you know, all white. And so my husband and I, we didn't know anything about the special education process at this time. We were barely navigating, you know, the disability systems as far as like medical appointments and, you know, therapists and things like that. But it was so overwhelming, almost intimidating. We were very uncomfortable. I mean, I wonder, you know, what things I know how it would have been. I would have felt a lot better, you know, having, you know, someone who, you know, looked like me at the meeting, or even able to help prepare me for the meeting in advance and so forth. So next slide. So this is our Center for Family Involvement's cultural brokering model. If you see right in the middle of the screen, cultural brokers, and then there's the arrow that points to the Center for Family Involvement at the Partnership for People with Disabilities, as well as the other arrow to the right is pointing to service providers. Above that is community, and part of the community obviously are families and caregivers, right? So these are some of the things that cultural brokers, do. We're connectors, we help educate, we network, sometimes we mediate, we negotiate, among other things. Next slide. I thought it would be really helpful and before we do this, I wanted to talk about, you know, cultural brokers. There are 5 of us, but we all work differently with the communities, with the families that we work with. We're all different, and the families that we work with are different. So we all have a different approach. So we don't all work the same. like our culture broker to the refugee and Arabic community, Amel, she is in Northern Virginia. And so she does a lot of interpreting and, you know, providing translation to families. Obviously, that's not something that I do. I speak English. Most people in my community, that's what they we speak English. Also, Amela runs like a support group online, and it is huge. I think she may have like 1,000 people in her support group, maybe even more. I may be lowballing that. Our two Latinx, Latino culture brokers. We have one who works in the Central Virginia area, like myself. But like I said, we cover the state. And one of our regional network coordinators may reach out to us. Hey, I have a family that we would love if you could support the family. The family wants to work with you. Blah blah blah. But like I was saying before, so we have two Latinx. The one in the Central Virginia area, Edgar. Edgar, he runs a support group at the Sacred Heart Church in Richmond, and that has been going on for a while. He just took it over quite recently because he's a fairly new hire, but he's very familiar with working with the Center for Family Involvement. But that was established by one of our other culture brokers who was with us for a long time, Nubia Quick. But like I said, Diego, he runs a support group there, and what he does looks differently from what the other Latinx cultural broker in the Tidewater area does. Very different. And like I said, we all do things differently. It's just it just varies. It just varies. So I wanted to mention that. So really quickly, I wanted to talk briefly about some of the some research that was done on our model and some of the findings. So like you see here, these were interviews from key informants as well as cultural brokers, as well as families. Next slide. So these are some of the perspectives from key informants. Okay, so we all have different opinions of what a cultural broker's role is. And next slide. Cultural brokers, this is some of the things that we shared. We're liaisons, we're educators, we inform, we provide, we help people understand. But all of us agree that, there are times where we do advocate, but we don't see ourselves as advocates, because our goal is to help families become advocates for themselves, because we're only with that family just a very, very short period of time. That family is in it for the long haul. Most families are going to be having to navigate the different disability systems for years and years to come. So the more that they're empowered, the better off that family will be. Now we know that, not all families, some families need more support and need that advocacy piece. Initially, a lot of families do, but most do not. So that's what we don't see ourselves as advocates. We want families to be able, we want to help families, we want to help give families the tools so that they can advocate for themselves. Next slide. Okay, so I wanted to highlight some of the survey findings from families. And this particular, I guess I should tell you, I believe these interviews were done in 2017 or 2017. And so, so here's some of the families' perspectives. So 58% of families believe that cultural brokers should be listeners. As you can see here, almost 59%. Another chunk of them, 55%, felt that families should be translators. Another almost 52% feel that cultural brokers should be educators. As you can see here, liaisons, and then 17%, a little over 17%, see cultural brokers as mediators. So those are some of the perspectives that families had. Next slide. So now families' preference on cultural brokers and characteristics. So this is a Likert. So, okay, so this was a Likert scale that was done. Okay, so 86%, 86.2% of families agreed or strongly agreed that cultural brokers should come from the same culture that they're from. They felt that they should have the same background. Only not many disagree. Well, I can't really see here because this is in the way, but okay. And then some of them, as you can see, a small percentage, 3.4%, they didn't really care. But 93% felt that cultural brokers should speak the same language as them. 69% felt that, you know, the cultural broker should have a child with a disability. And as you can see, the other statistics there, the other numbers there. Next slide. Culture versus language. So our culture brokers felt that language is the biggest barrier when it comes to working with families, helping families navigate the different disability systems, even looking at some of their own experiences. They felt that language is the biggest barrier. And I don't know if I mentioned that both of our Latino cultural brokers are native Spanish speakers. They're both from Colombia. Next slide. And then these are just some numbers about family satisfaction. 69% of families were very satisfied. 27% were just satisfied. And 3.4% were very dissatisfied. Next slide. So what? So what does this mean for you, for your organizations, for, what does this mean? Well, as we know, like the country is becoming more and more diverse. I would hope that, if the need arises, that more people will look into using cultural brokers. I know that, and some people may call it, some people may call it like a peer-to-peer model. I really wish that school systems would use cultural brokers. But I really wish school systems would implement something like this, even just like a peer-to-peer model. Yeah, but it's very important. The country is becoming more and more diverse. Virginia is very, very, very diverse. I think in Northern Virginia, there are like hundreds of different languages that are spoken. I really feel for Fairfax public school system because I don't know how they do it. They have many, many, many languages that are spoken. And if need be, you can reach out to us. And if need be, you can reach out to the Center for Family Involvement. And I had something else that I wanted to say. I don't have my notes here. Okay. I was looking at the comment section. A couple people commented that they hadn't heard of the term before. Yeah. So I hope that I was able to educate you just a little bit about, what a cultural broker is. There are different levels of cultural brokers. We just specifically work with families and caregivers of people with disabilities, or people with disabilities themselves, self-advocates. Yeah, so hopefully there'll be some takeaways. If you have any questions, feel free to ask. I will have my contact information. Next slide.
I have a couple of questions, actually. Thank you, first of all, for this, because I thought this was really good. The first thing I wanted to know, because we just talked about the languages, when you get a hold of somebody who has a different language that's not covered by you guys, do you use interpreters yourself?
That's a good question. Yes. Like me, I'm a culture broker to the African American community, but I do work with other communities too. I work with families who may be from Somalia or Ethiopia.
Right.
So we do use a language line. So we do have a language line that we use. It's not ideal, but it's better than not having anything. So,
Right.
and we do use, and we'll reach out. I mean, there are times I'll reach out to Fairfax for, different materials that have been already, translated, specifically related to like school stuff to help, families. But yep.
Is there a cost to families working
Like
with
I
you?
said, we're 100% grant funded, so there is no cost at all to families.
Okay, thank you. I know
You're very
Dee has
welcome.
her hand up.
Yes, thank you. Also, Moretta, this is so interesting. We used to use the term culturally competent and meant you got training and things like that. Is there a component of that for the cultural brokers as well?
Yes, there is. And those are definitely two separate different things. Cultural competence is something that, it's always evolving. You know what I mean? I don't think that anyone I don't think that anyone could be, in my opinion, I don't think that anyone could necessarily be culturally competent, but I think that, we're always evolving, learning and growing. I know that we do get training through the Center for Family Involvement, Partnership for People with Disabilities. I know that I remember years ago, the people who do it well, if you really want to learn about cultural competence, and you all may have already heard of them, Georgetown's National Cultural Competence Center. I should have put their information up because I know Tawara Good personally, and she is amazing. And I really need to go to their website and just look at some of their updated information. It's been a while. And like I said, I just kind of, define the way we do our cultural brokering model. I didn't do a deep dive into cultural competence type of, I didn't do like a cultural competence training. I didn't do any of that. But yes, there is definitely a difference. We do that with our regional network coordinators, as well as our family navigators. There is a cultural competence or cultural humility or agility component to our trainings.
Thank you. And I had a couple more questions. You mentioned some support groups. Could we get a listing of those? I try to be very inclusive on the support group list I have posted on our website. Can you mentioned some?
Great, absolutely. I can certainly do that. Yeah, there are a couple of support groups, so absolutely.
Okay. Okay, thank you. And my last question, you mentioned aging families. And could you talk more about that?
Yes, one of our liaisons, Norma Draper, she works with, mainly families and caregivers of people with disabilities. And so they may reach out to her asking for supports for their loved ones, but I can certainly get you her contact information.
Okay.
Our CFI helpline number was just up, as well as our CFI helpline's email. Feel free to, if you all have your phones handy, you can just take a screenshot of that. And so, excuse me, that'll get you, information about Norma. And I have her number. Norma has a lot of experience in working with people with disabilities. I mean, she's done it for many, many years. Probably about 40 years. And, like I said, she used to, we were talking a little bit about Medicaid services earlier and the waivers. And I remember she was my daughter's service facilitator several years back. And she's an amazing individual. But yeah, mainly working with families who have aging people with disabilities. Yep. I appreciate you all taking the time out of your day to listen to me.
A
Thank
question.
you
Sorry,
so much
before you
for
close. Thanks so much, Moretta. That was really interesting. And certainly I have learned a lot about cultural brokers since I didn't know really anything. But my question is about research. So often we hear, I know you're working mainly with disability programs, but we do hear a lot, certainly in the, for example, in the Alzheimer's Disease and Related Disorders Commission, that researchers often struggle to recruit people for clinical trials or research projects who are in, I guess, what could be called underserved communities. So maybe communities that aren't reflective of the majority. And I wondered if you knew of any cultural brokers that specialize in research, or whether people in your office do that, or anything you can shed light on for me, that would be great.
Question. I don't know of any cultural brokers specifically who do research. However, we do have our diversity. We do have a couple of we do have a diversity specialist, Yali. She's one of our researchers. That may be a good question for the National Center, National Cultural Competency Center in at Georgetown University. George, I'm thinking that I know that with us, I mean, there have been quite a few research projects that have been done through the partnership, but cultural brokers specifically doing research, I'm not aware of, but we do have researchers who, you know, I know of researchers who do this type of work, and I guess maybe you do too. But
yeah, so I was thinking more of cultural brokers as a go-between between the researchers and the communities that they're looking to recruit from.
Oh yeah. I'm sorry, I misunderstood. So yeah, we do that. We typically provide, we typically through our networks will, look for families that may want to participate in those research projects.
Okay, great, thanks.
Does anybody else have questions? Well, thank you for your time, Moretta. I really enjoyed your presentation. And Nick, I guess I'm kicking it back to you.
Okay. Yeah, thanks, Moretta. If you don't mind, I plan on making your presentation available with the meeting minutes as well. And I can add any contact information or anything that anyone wants to that. So I just want to wrap up. I wish Chris Newfer could have been here today. He missed a really good presentation. Hopefully he'll watch the recording when we touch base again. Thank you everyone who's able to attend. George, I'm glad you were able to come in halfway through. I know we had some people who said that they were coming in late and we had them come in. So I'm glad I got to see everyone's face today. Thank you all for attending. It really is a pleasure. I do look forward to our meetings every other month. If anyone has any information they want to share with the VCC, please reach out to me. I'm happy to do that. And if I take too long, send a follow-up email because sometimes it gets buried. And with that, I would like to say, everyone have a wonderful day. Again, Moretta, thank you very much. I will make the meeting minutes and the recording available hopefully by the end of next week. So.
Having me.
Thank you guys.
Thank you, Nick.
Bye. Thank you.
Bye.